Hi, this is Mike Broadwell. I'm the Theragem trainer for the U.S., and I'm here with Cindy Kubika, my good friend and semi-neighbor. She's about 70 miles away from me, just outside of Nashville, Tennessee. And she's got a pretty amazing story to tell about her father and his stroke recovery from just about a little over 2 years ago, I guess now, wasn't it, Cindy?
Yes, it was actually June of 2013. And Dad had a brainstem stroke. And the survival rate for somebody who's had a stroke in the brainstem is about 60% or 66%, something like that. So it's not very good, but he did make it through it. However, he was paralyzed on the right side, and he had no movement in his hand or his foot, nothing whatsoever for a long period of time. And the doctors didn't think he was going to recover at first. And then Mike offered to let us use the Theragem, and we thought, what the heck? And at first, quite honestly, I didn't think it was going to do anything. And within 30 seconds, Dad was first able to move his thumb. I don't know if you remember that. I have video of it. And he was able to just twitch his thumb. And then pretty soon he was able to twitch a couple of fingers. And each time that we did it, he had more and more improvement. And it was shocking to see. In fact, we have video of it, Mike, and I'll make sure that I share that video with you, because it truly is incredible to see him go through, having no movement whatsoever. And then all of a sudden he's getting movement in his hand. And then eventually he was able to start moving his whole hand up to his mouth, being able to use it more in his foot. His leg started moving more. He was able to kick it out. It was incredible to see.
I think it was almost 3 weeks to the day after the stroke that we did the first session on him up at the Vanderbilt Rehab Center.
Yes, and at that point they were thinking he's not going to make any improvements after 3 weeks. They thought he would be about where he was going to be, maybe a little bit, but he was already in physical therapy, but they just didn't have a lot of hope for him recovering as well as he did. But it was always with the Theragem, and I would bring in the doctors and the nurses and the therapists and let them see the difference. And they loved it, Mike, when we were able to do the Theragem just before he went to his physical therapy and occupational therapy, because he had much more mobility. He had stronger hand and leg, so he was able to do a whole lot better during the therapy. It was cool.
Yeah. I remember that first session because it was 3 weeks, I think to the day, like you said, and he did. His thumb started twitching, and I think you said that was the first movement, except for when they kind of electroshocked him, to stimulate the muscles, which is not him moving. It's just the electroshock. But that was the first. I remember you and your sisters were crying when you saw him just wiggle his thumb there.
Oh, yeah, we sure were. We were just shocked by it, because we were listening to the doctors, or hearing the doctors, give us this message of doom and gloom, and to see this much recovery was just phenomenal. And slowly, every time that we used it, it got better and better and better.
Yeah, I think I came up there 2 or 3 weeks in a row. And then I remember after 3 or 4 times, he got to where he could engage his quad muscle in
right.
his leg.
Yeah.
And he got more where he could move his arm even more. And then I went out of the country for a while, and I left the unit with you, and you used it I was gone for 10 weeks, I think. So you were using it pretty regularly during that time.
Yeah. Yep, we used it the whole time. And what was really funny, I didn't use it for a couple of weeks because I had a lot going on and wasn't able to go see him. And my aunt was not comfortable using it, so he didn't get any therapy for a couple of weeks. And his eyes were really bothering him. And he said, when I got there, he said, I need to go to the eye doctor because my eyes are getting worse and worse and worse. And he is diabetic, so that kind of comes with the territory. And he was having a really hard time focusing. And I don't know if you remember this, Mike, but I brought in the Theragem, I put it on him, and he had no idea that I even set it up. And I was doing the Theragem on him, and he was watching the TV, and all of a sudden he took off his glasses and set them down, and he said, I can see the TV. It's like all of a sudden my vision cleared up. And I said, Dad, I just did the Theragem on him. And he turns around and he looks, and he went, oh my gosh, I had no idea that you already put it on me.
I remember that. I walked in because I had met you in town and gave it to you, and I had to run an errand. I said, go ahead and get him started, and I'll meet you at his apartment. And this was what, about 3-4 months after the stroke by then? He was already living on his own.
Yeah.
And so I remember that because I just walked in and you just turned it on, and I remember him saying that. He's like, oh, I can see now.
Yeah. It was about 6 or 7 months because he was in a assisted living, his assisted living environment by then. But even at that point, after that long, when they say he is where he is and he's diabetic, and once again, you get this doom and gloom kind of a report from these medical professionals, and to see this kind of progress, it just made such a huge believer out of me. Huge.
At first you told me when you were kind of running it on him routinely that he would only show movement when the Theragem was actually on him, and as soon as it would turn off, he wasn't able to move. But then you said he got to where he could hold the movement, obviously, and he did. He actually got, I don't know, what percentage recovery did you think he got to?
I would say that it was about 15 to 20%. And for somebody who, once again, that suffers a brainstem injury like he had, and it was very large, and it was slow moving, and to get that much recovery, they never expected that much. So while he didn't fully recover, he did get it slowly. He got more and more use. In fact, I guess out of his leg, it would be probably a little bit more than that. It'd be 20 to 25%, because he is able to stand, and they didn't think he was going to be able to stand either. So he was able to stand. And the way that worked, Mike, was he was, right after we did it, the first few times we didn't see him hold on to any of that after we stopped the light. And then slowly he would hold on to it for 10, 15 minutes. And then it got up to 30 minutes. And then I would say within about a month, he started holding it all the time. We do it in the morning, and it was consistent until he got tired. By the end of the day, when he got tired, then we found that it wasn't successful. And by the way, that being said, we also found out that it was more successful to do it in the AM than the PM. So we did it first thing in the morning. We always had greater success.